One of the most common reasons why patients come into our practice is to address their nasolabial folds and tear troughs underneath the eye. However, both of these problems actually come from changes in the cheek area. So to explain why, I'm going to explain a little bit about aging. So we actually have 5 layers to our face: the bone, the deep fat, the muscle, superficial fat, and then skin. And as we age, there are changes occurring in each layer. So it's important that we address the actual underlying cause rather than the symptom. I like to refer to the cheeks as the bra of the under eye. The reason why is the deep fat pad in the cheek lifts and supports the under eye. And as we age and you lose that deep fat pad structure, the mid-face starts to descend, and it creates this heaviness that weighs down on this nasolabial fold, and it creates a hollow underneath the eye called the tear trough. So by revolumizing throughout the cheek, we can lift and support the under eye and camouflage the nasolabial fold. Unfortunately, the deep fat pads in the cheek do start to deflate as early as your mid-20s. So you'll actually start to notice these changes in the mid to late 20s. So that's a great time to get started because you're going to require a lot less volume in order to get the improvement that you're looking for. A common concern that I hear with injecting dermal fillers throughout the cheek is patients are very afraid of looking more round or more full. But it's important to note that the techniques that we utilize here and the products that we select are specifically formulated to give you a more contoured look that looks more structured and less round. After we properly address the cheeks, then we start to look at the under eyes and nasolabial fold. Anything that's left that wasn't taken care of with the cheek filler, we go ahead and address with either under eye PRF or under eye filler to really put the cherry on top. Under eye filler is used if you still have a hollow underneath after we address you with the cheek filler. If instead the under eyes are just dark, then usually that's the fact that you can see the muscle underneath the skin and the skin is quite thin. So by injecting PRF, we can thicken up the dermis underneath the eye and reduce the visibility of the muscle, therefore decreasing the dark circles. My favorite way to address the nasolabial fold is actually to restore the deep fat pad that has been lost underneath it. This is called injecting into the piriform space. Again, like Temple, this is actually a more dangerous injection. So it's really important that we look at the vasculature in the area with the ultrasound that we have. So we do something called vascular mapping where we draw out exactly where your blood vessels are so we can avoid hitting them with the dermal filler. Also, we aspirate every single time we inject, which means when we place the needle in, we pull back on the plunger. If it flashes red, that means we're in a blood vessel, and it tells us do not inject here. We pull out, change the needle, and go somewhere else to get you the result you're looking for. We also only use dissolvable filler, and we have 20 vials of the reversal agent on hand at any point. So if we do accidentally inject into a blood vessel, we can quickly reverse it. Mid-face is one of the best places to start on your aesthetic journey. The mid-face is the anchor of the rest of the face. So if you've started to notice things like jowl or lower face heaviness, actually addressing the mid-face is the better place to start. Because oftentimes as we age and we get that descent, the face falls down and inward, and it creates this heaviness all along the nasolabial fold and into the jowl. So properly addressing the mid-face can lift and support and actually camouflage a lot of the issues that you're seeing in the lower face. So before addressing the jowls and anything in the lower face, we really need to address the mid-face first and make sure that looks perfect.